From the Health CMI newsroom, today, how acupuncture helps people after low back surgery. People often have lumbar disc herniations and get surgery, but that's not a guarantee of a speedy recovery. So with devices like this, a little electro acupuncture goes a long way to getting rid of pain, numbness, swelling, even preventing infections after surgery. So if we go to the healthcmi.com newsroom and look at the article entitled Acupuncture Post-Op Lumbar Disc Herniation Relief, that article shows a set of acupuncture points that's been shown in modern research to help people recover after surgery. So this is very important. It's not the only thing in the newsroom showing this integrated approach. In other words, people have always said, hey, isn't it like East versus West? They're not compatible. One's real, one's not real. One's good, one's not good. I'll tell you what's good is not living a life of suffering and debilitation. So nobody wants pain. Nobody wants numbness. No one wants weakness in the limbs. So let's say someone gets surgery. The steps towards recovery after surgery aren't necessarily just bed rest. And maybe a little bit of physical rehabilitation is very important with physical therapy. Maybe they will need some medication. Maybe they will need some hot and cold pack. A lot of things go into soothing the body after surgery and getting it better. So this research shows that acupuncture is one of those things that gets great results. And the details of the surgery follow it out quite a bit before and then after the surgery. And in the healthcmi.com newsroom, you can look it up and see all the details. It'll get into the statistics, very detailed, of the CT scans, the MRIs, the x-rays, confirming the results. But basically what we know is a handful of points. In this case, they were what we call distal points in Chinese medicine. So stomach 36, gallbladder 34 and 30, and bladder 40, which are Chinese medicine special points on the body that are stimulated, achieve those results. What we want is less swelling, less pain, less numbness, better range of motion. And this article is a pretty good one. I like it especially because it's not the only one in the Health CMI newsroom. There's hundreds, if not thousands, dating back years and years. And take a look in the newsroom and you will see. Now, a device like this is something that wasn't mentioned. I love this device. No, the people at Ito did not pay for this. It's not a sponsored thing. I bought this on my own. I use this quite a bit in my clinic. This is the Ito ES130. Quite possibly one of the greatest electro acupuncture devices ever made. And what I love about it is program 1. So what this is an alternating slow pulse between 1 and 6 hertz that we can run through the area where the disc recovery surgery was made. And again, there might be some scar tissue, there might be some nerves that are a little bit injured. We want to get the blood circulation, the microcirculation back into that area and quell that fight or flight response. We want to quell the sympathetic nervous system response and increase something called parasympathetic tone. In other words, the body's electrical system is not creating a fight or flight response and not promoting things like histamines and pro-inflammatory cytokines. In other words, pulsing like this on the low pulse we've seen in other research can basically bring in anti-inflammatory cytokines. So cytokines are biochemical agents that help cells communicate. And there's some that communicate increases inflammation, others that increase IL-6, TNF-alpha, other pro-inflammatory agents. And then there's anti-inflammatory agents as well. And what we know from the research is acupuncture can enhance the production of anti-inflammatory agents and decrease pro-inflammatory agents. And it does this by decreasing the sympathetic, these fight or flight responses. Because the autonomic nervous system operates on both parasympathetic and sympathetic balances. So if we read an anatomy and physiology book, the sympathetic response is something like running from a tiger. Whereas parasympathetic tone is more involved in sleep, digestion, wound healing, things like that. And the body is always needing a balance of these things. Acupuncture definitely has a remarkable ability to balance parasympathetic tone with sympathetic stimulation, and that in turn quells those pro-inflammatory cytokine productions and increases the anti-inflammatory effect. That's what I like about that after surgery. So for me personally, I think it's an essential part of a follow-up surgery. I asked the surgeon, I said, why do you like acupuncture so much? You know, I thought maybe you wouldn't like us. You thought us as something different and weird or outside of the system. He said, no. All I know is I don't get that call at 2 in the morning, 3 in the morning, 4 in the morning that something's wrong. I know they get the acupuncture, they're getting the proper follow-up, and things just heal better. In a longer discussion after that, that particular surgeon who runs a very respectable hospital, the chief surgeon there, said that basically he's going to fix the plumbing. He's going to reconnect parts and get rid of unwanted materials, but the body still needs to heal. And that, in this case of an integrated treatment, is exactly where acupuncture comes in. So that's why I really like it, because you have this integrated approach, and it's not about getting the patient from point A to point B. It's from point A to point Z. In other words, full recovery. And what is it going to take? There really are steps before getting into a lot of physical therapy exercises, because right away the body's still very raw. We want to contain that. We want to decrease inflammation and increase the strength of the patient. We also want to increase something called work hardening. And in other words, we want the patient to be able to do more work without re-stimulating the problem. They should be able to lift weights. They should be able to bend and twist, things like that. And the acupuncture can increase the integrity of the sinew, of the flesh, of the tendons, of the muscles, of the ligaments to get that done for the people. So I thank you all for coming today. I hope you learned a little. Again, go to healthcmi.com, learn a little bit about this acupuncture integrated approach. It's definitely the cutting edge, where we want that as something for a surgical recovery. It's simply going to help the patients recover and get back to their normal lives. I'm Adam White, licensed acupuncturist for healthcmi.com. Thank you for listening.